To AWANI Tonight with me, Farhana Sheikh. Updates to the National Recovery Plan. COVID-19 hospitalisation rate will be the new metric to assess transition from the second phase onwards. And how should the SOPs for the fully vaccinated be approached by the government? That's coming up. Finance Minister Tengku Datuk Seri Zafrul Tengku Abdul Aziz said that Malaysia will no longer use daily virus infections as a metric to ease curbs for states once they enter the second phase of the National Recovery Plan. The government will instead use COVID-19 hospitalisation rate as one of the three indicators to allow states to move to the third and the final phase of the plan. The hospitalisation rate must be 3 cases per 100,000 of the population for states to move from the second to the third phase. To get to the final stage, the rate must be 1.3 cases per 100,000 people. Zafrul said the other two threshold, vaccination rate and ICU occupancy, will remain the same as previously announced. Currently, only the states of Penang, Kelantan, Terengganu, Pahang and Perak are in the second phase, which allows for opening up more economic sectors. The government has also allowed Perlis, Sarawak and Labuan to enter the third phase beginning Wednesday. Zafrul's announcement came as COVID-19 cases in Malaysia exceeded the 20,000 mark for the first time today since the pandemic started last year. The Health Ministry recorded 20,596 infections over the last 24 hours. Selangor and Kuala Lumpur accounted for almost half of the new cases, while Kedah reported a high of 1,446 cases today. COVID-19 death toll, meanwhile, breached the 10,000 mark after another 164 patients died in the past 24 hours. On average, Malaysia has lost over 110 people to COVID-19 each day between June 1st and now. Many among those fully vaccinated are looking forward to the SOP relaxation. However, with new cases at a record high, what's the best course of action for Malaysia to relax restrictions and return to some semblance of normalcy? We asked Senior Public Health Physician Professor Datuk Syed Muhammad Al-Junid what are factors to consider when opening up economic and social sectors.
Two things. Number one, we have to look at how infectious this Delta variant is and how this can be prevented with the vaccines. From our data that we have at the moment, it seems that most of the vaccines available are still able to actually prevent the spread of this Delta variant.
Professor Syed was referring to European countries and the UK that managed to decrease the number of hospitalisation and fatalities from COVID-19 after vaccinating a large number of the population.
In terms of the number of cases, we should not actually or use this number alone to decide on the cases, because at the moment there are a lot of people who are doing their own testing, and then furthermore 95% of the cases are actually cases which are mild, which means that we are going to reach a situation of endemicity pretty soon once we achieve high level of vaccine coverage. From my perspective, I feel that once you achieve more than 50% of the immunization coverage, and then the infectivity rate, or we can see the RT level, goes down below 1, probably this is the time where you can start to open all the other sectors which are important.
The Health Ministry has granted conditional approval for the Moderna COVID-19 vaccine for emergency use. Health Director General Tan Sri Dr. Nur Hisham Abdullah in a statement said that the ministry will continue to evaluate the quality, safety and efficacy of the vaccine to ensure that its benefits outweigh the risks. Moderna's Spikevax vaccine was registered by Zulek Pharma Sdn Bhd and manufactured by Rovi Pharma Industrial Services in Spain. The initial course of the vaccine consists of 2 doses with 28 days interval between doses, as recommended by the World Health Organization. Last month, the Health Ministry approved 2 other vaccines for emergency use, namely from China's Sinopharm and United States Johnson & Johnson. The drug Avamactine, which has been long used for veterinary treatment of parasites, has come under the spotlight after calls for it to be included as part of Malaysia's list of treatments for COVID-19. With clinical trials being done globally, some have argued that the use of the drug have helped certain countries to manage their COVID-19 cases. However, Does the sign match the argument? We speak to public health specialist Professor Dr. Sharifah.
So a lot of studies have said that, Avamactine can also be used to treat COVID. Now, the issue is that a lot of these studies are inconclusive. That means it's not really matched. Some of them are using different dosing. Some of them are using different severity levels. And, certain others are using different population and so on. So the issue is that we need to have a standardized, so-called a randomized control trial. This is where the best so-called power of study is. So some of the randomized control trials are available, but again, some of them are again inconclusive. Some of them, a lot of them has actually shown that it works, but some of the so-called the world organization, so things like WHO, even US FDA and things like that, have not really approved it for human consumptions in the sense that we're going to treat it for COVID.
Health Minister Datuk Sri Dr. Adam Babar said that clinical studies have been initiated at 18 government hospitals. A total of 500 high-risk and mildly symptomatic COVID-19 patients are involved in the trial to determine the safety and efficacy of the drug to treat COVID-19 patients. He added that the results of these trials would be available in September. The ministry has also clarified that as of now, Avamactine is only allowed to be used on an off-label basis.
You can use it under off-label medication in Ministry of Health, but the patients cannot actually demand it from the doctors saying that, oh, I'm admitted for COVID, I want you to treat me with Avamactine. We cannot do that. It depends very much on the doctor's purview. So at the moment, this is where the debate still is. We have to look at a few more studies, but I do agree that some of the studies are actually looks very promising. And I know a lot of doctors as well are actually trying to push this drug so that it can be dispensed for a lot of people. But we cannot just say that we can do that without proper trials and without proper guidance, because that will be irresponsible for the government to do that.
With Avamactine yet to gain clinical approval for human use, Dr. Sharifah urged for the public to trust evidence-based information on the drug and to be patient in waiting for the results from the Health Ministry's clinical trials.
We have to follow evidence-based medicine, or basically we have to follow what trials have shown, results from other studies and things like that. We cannot just say a few anecdotal evidence and say, oh, it's good enough for us. We have to be very careful. So in that sense, I have to really tell our public to be very wary about all this information, and please follow the latest development. And I do agree that if this is good and we have enough evidence to say that it does, I do urge the government to actually propose this as one of the treatment for COVID. We cannot deny this, since this is very cost effective, it's very cheap, it is relatively safe, but we don't have enough evidence yet. We have to wait for a while until we get more data, and later on maybe we can actually put this into one of our essential medicine for COVID as well. So there's pros and cons for everything. So I would say that take it with a pinch of salt. Do not be too dependent on Avamactine. It comes with side effects as well. So please follow the latest available so-called review.
We'll take a short break. Stay with us. Welcome back. The World Health Organization is calling for a moratorium on COVID-19 vaccine boosters until at least end of September. The move was to ensure at least 10% of the population of every country is immunized. WHO Director General Tedros Adhanom Ghebreyesus made the appeal yesterday, mostly to wealthier countries that have far outpaced the developing world in numbers of vaccinations.
High-income countries have now administered almost 100 doses for every 100 people. Meanwhile, Low-income countries have only been able to administer 1.5 doses for every 100 people due to lack of supply. We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries.
Some countries have begun to use or started weighing in on the need for booster doses, including Germany, the UAE, Israel and the United States. Despite the appeal by the WHO, Germany plans to go ahead and give booster shots to its vulnerable population starting September. Its health ministry said this is to ensure that those who are particularly at risk are adequately protected. It said risk groups include immunocompromised patients, the very elderly and nursing home residents. Germany has rejected WHO's accusations that rich countries are hoarding global vaccine supply, saying Germany would also donate at least 30 million doses to countries in need. Meanwhile, French President Emmanuel Macron says it is likely that the elderly and vulnerable will need a third vaccine shot, and that France is working on rolling this out from September onwards. Macron is trying to step up France's vaccination program as the country faces a fourth wave of the virus and street demonstrations in protest against the government policies, including a mandatory COVID health pass for entry to public venues. Japan is set to expand its COVID-19 emergency restrictions to cover more than 70% of the population. Prime Minister Yoshihide Suga announced the new steps as new daily cases in Tokyo were set to top 5,000 for the first time. Health experts warned that the figure could double in 2 weeks at the current rate. Economy Minister Yasutoshi Nishimura, meanwhile, said new infections are rising at an unprecedentedly fast pace as he proposed quasi-emergency measures for 8 more of Japan's 47 prefectures. 6 prefectures, including Tokyo, are already under full states of emergency to last through August, while 5 are under less strict restrictions. Nishimura warned that the situation in hospital is severe, adding that serious cases related to COVID-19 have doubled in the past 2 weeks. Just under 31% of residents of Japan are fully vaccinated. Dozens of people were injured in Lebanon's capital when police clashed with protesters demanding accountability for a devastating explosion at Beirut's port last year that killed more than 200 people. Scuffles broke out between riot police and demonstrators, a short distance from the main event marking the tragedy's anniversary. Thousands of Lebanese also took the streets to mark the anniversary and to demand justice. 1 year on, no senior official has been held to account. Political leaders are widely accused of obstructing justice after a domestic investigation has yet to yield significant arrests or even identify a culprit. On August 4, 2020, a stock of ammonium nitrate fertilizer haphazardly stored at the city's port exploded, killing more than 200. Some 6,500 were injured and over 300,000 people were displaced. The blast caused widespread destruction in the capital. According to UN estimates, about 9,700 buildings were damaged or destroyed. What repercussions will Malaysia's recent downgrade to the worst tier in US's Trafficking in Persons report have on bilateral relations? Tonight on Consider This, we ask our guests what incentives there are for change. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Farhana Sheikh. We'll see you again.